Hi, my name's Peyton Elliott. I'm from Oswego, Illinois. Before coming to school, I was a sterilization tech for a dentist up in Geneva, Illinois. And I'm now working for the simulation lab for the nursing students here at Parkland. And my long-term goal would be to graduate this program and pass the board exam. But my most short-term goal I guess I have is to develop a good study habit and a good study plan to best succeed in the course. So this is Jacob. He's my boyfriend. He just got here last night. So go ahead and introduce yourself.
I'm Jacob. I go to Waubonsie up in Sugar Grove, and I am majoring in automotive technology.
So if you ever have any problems with your car, I can FaceTime Jacob. He has a really big knowledge in that stuff. It's like his niche. Okay, so I'm going to ask you a question, and then I'm going to discuss what I've been learning this past week in a couple of my classes. Okay? So in your understanding, what does a dental hygienist do?
A dental hygienist is in charge of the general upkeep, but also then reporting back to the dentist of their findings and going from there, or also cleanings as well.
Okay, so when you go to your dental office every 6 months for your cleaning, we'd call you a prophy, a generally healthy patient every 6 months. What does your dental hygienist do?
She would sit me down and then go over my past history, and then either if I'm there for a cleaning, perform the cleaning, or do the general inspection to then report back to the dentist.
Okay, so he's a little educated because obviously girlfriend who's interested in it, he knows a little bit more than probably my sister would and what you were saying too with reporting back to the dentist, we do have a name for that. It's called general supervision, which is what we have in Illinois, where a dental hygienist can provide her own treatments or their own treatments, but they do need authorization from a dentist to do so. So, okay, so then I'm going to talk to you about what I've learned. We happen to learn in pre-clinic too, but also in this prevention course about the roles and responsibilities of a dental hygienist. So, while yes, dental hygienists do perform cleanings, they're also just vital healthcare workers as related to your mouth. But they work interprofessionally with other healthcare workers, other healthcare professionals, to best care for your whole well-being, your whole body, because the mouth is connected to the whole body. So every day, hygienists will assess, evaluate, and diagnose care. And this is those you were kind of discussing. Like she'll go over my past history and she'll do this. That's part of the dental hygiene process of care. There's 6 components. And it's, again, to assess, evaluate, and diagnose whatever might be going on in your mouth. But then also to plan and implement treatments. That could be, I think maybe a fluoridation service would really benefit you. So she'd plan and implement that. And then document either her findings or whatever she did that day. So that then she could pick up wherever they left off last time.
Right, yeah.
They're mainly involved in preventive dentistry. So these are mainly dental practices which are designed to promote not only your oral health, but as it relates to your whole body as well. Their role, however, in preventing dental diseases is through mainly educating patients and providing therapeutic care. And that's kind of what I'm practicing right now, the education component. I'm practicing talking to you as if you were a patient.
Right, yeah.
So in clinic though, this could be through teaching patients how and why they should be developing good home practices, health, oral health practices. They also have a huge ethical responsibility. Hygienists are, they're accountable for providing treatments that they deem as right, and that could be from, having a really strong foundation of education or critically thinking what could be best for this patient. So they have a big ethical responsibility to provide care to the public. So basically though, every day, both as a hygiene student and also once I become a dental hygienist, I will be engaging in those 6 components of the dental hygiene process of care. So assessing, evaluating, and diagnosing, but then also implementing, planning, and documenting findings that I may find on each patient. But I will also be not only a clinician, so cleaning teeth and kind of going over those 6 processes, but I'll be an educator when I'm practicing right now, and I'll be an advocate, a manager, and a researcher, which I can continuing education. That's also part of the ethical responsibility. I'm accountable for making sure that I'm the most educated clinician or dental hygienist my patient could have. Yeah. So I'm a researcher too.
Very nice.
So, and then the last component was why I want to go into dental hygiene. So, I mean, I wanted to be a veterinarian and then a paramedic for a while.
Mm-hmm.
I've always wanted to do something related to health, mainly because I love learning about like anatomy. So dental hygiene not only allows me to continue to pursue my enjoyment of anatomy, but it also, it's way less bodily fluids than like nursing or doctors.
Yeah.
So, like there's still bodily fluids, but not some from the other end. It also allows me to potentially get to become an educator. I've always loved the idea of getting to go back and teaching. I always like explaining stuff. I like talking things out. So, by going into dental hygiene, if I were to later go back to get my bachelor's, maybe even at SIU's online thing I was telling you about, how SIU has an online dental hygiene degree completion for education.
Yeah.
I could go back and teach maybe at College of DuPage. So,
yeah.
Alrighty. So we're about at time here. So, thank you, Jacob. Thanks for watching, and see you in class. Say bye.
Bye.
Bye-bye.